Contraceptives lecture. So there are several types of contraceptives out there, and we will start with barrier methods. And the purpose of barrier methods is to either kill sperm or prevent them from entering the cervical os. And this is done by either condoms, diaphragms, or cervical caps or sponges. Diaphragms must be fitted, and if a patient gains or loses 15 pounds, they will need to be refitted for their diaphragm. The diaphragm is about the least effective means of birth control out there. Condoms and cervical caps can be purchased over the counter. And all three of these must be used every time intercourse occurs. Hormonal contraceptives inhibit ovulation. They change the cervical mucosa. They affect the sperm mobility and prevent the thickening of the endometrial wall. Included birth controls are the pill or patch, vaginal ring, Depo Provera, or the Implanon implant. Oral contraceptives also treat menstrual irregularities, PMS symptoms, ovarian cysts, and ovulation, as well as an increase in bone density. Oral contraceptives must be taken daily to be effective, and especially the pill, it is important that it is taken at the same time every day for maximum efficiency. How it works: high levels of estrogen cause the pituitary gland to release luteinizing hormone. The luteinizing hormone causes ovulation. The lower levels of estrogen in the pill prevent the pituitary gland from releasing the luteinizing hormone. With no luteinizing hormone present, the egg does not mature and ovulation does not occur. The pill, here is a picture of various types of pills, and usually they come in a pack, and either they are in a circular type device or they will be in rows as 4 weeks. And it depends on the pill. Some of them are variable strengths of the hormone. Some of them are the same strength throughout the month. So it really depends on what is best for you and meaning the patient. A lot of times with birth control pills, that last week is a placebo pill. Sometimes we'll say it's a sugar pill. Patients are recommended to keep taking these pills even though it has no effect on their cycle. This week there is no medication in these pills, so the patient will get their menstrual cycle. However, we encourage patients to take them during that week to stay in the habit of taking that medication at the same time every day. And there are no gaps in treatment. Depo Provera lasts 12 to 14 weeks, 99% effective up until that 12th week. After 12 weeks, a pregnancy test must be done prior to the next injection. Injections consist of 150 milligrams every 3 months. A lot of times, as you can see, this medication is pretty viscous, so we like to give this in the dorsal gluteal or dorsal ventral muscle. The Implanon, as you can see in this picture, is a little rod type device that is implanted on the inside of the arm. It's about 4 centimeters long, and it's flexible plastic rod, and it releases synthetic progesterone, which stops the ovaries from releasing the egg, preventing pregnancy for up to 3 years. Some side effects of the hormone type contraceptives Serious complications, we have the acronym ACHES. A stands for abdominal pain, C for chest pain, H for headaches, E for eye problems, and S for severe leg pains. And then we have the intrauterine device. And what happens is this is a rod that is inserted into the uterus, and then the wings are then deployed and it forms a T. And it releases and it prevents pregnancy and stops that egg from attaching to the uterine wall. Permanent methods are bilateral tube ligation that can be performed in which a portion of both the fallopian tubes is excised or ligated, riskier and more costly than male vasectomies, and general anesthesia is required. Tubal ligations, there are a couple different methods. There's the cauterization. As you can see here, they clip the vessel and cauterize it. Tied, they tie off both ends, or they can also clamp it. And usually this is done with 2 small incisions, one by the belly button and then one in the lower abdomen. Vasectomies can be done in the office, do not require general anesthesia. What happens is they cut the vas deferens and they will tie off both ends. Usually they remove a segment to ensure complete ligation and make sure that there is no more sperm moving through the vas deferens.